Have you ever wondered how artificial intelligence is helping solve medical problems? Or how medical research is making it easier to predict your genetic risks for disease? Hi, I'm Kathy Werzer. Tomorrow's Cure, a podcast from Mayo Clinic and PRX, is back for Season 2. Join me as I interview experts who are shaping the future of healthcare with groundbreaking advancements. What they describe may sound futuristic, but listen and you'll find out. Tomorrow's Cure is already here. Find it now wherever you get your podcasts.
This is Heath Matters, a podcast from the Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about breast cancer treatment and life after diagnosis. For those of us who get breast exams and mammograms, there's always that period of waiting. What is the result going to be? And we all hope that it's going to be nothing. We hope for the word benign. We hope it's going to be great. But unfortunately, sometimes it is not. My own mother had breast cancer, and I was young at the time and really didn't fully grasp how deadly it could be. I had no idea that it was such a big deal. My mom said to me, I'm just going to get a lumpectomy. I'm going to get some radiation. That'll be that. Everything will be okay. And that's what she did. She lived a rich, full life for, I think it was 10 or 15 years after that. And then she got sick. It turned out there was a recurrence of the cancer and it was metastatic. And unfortunately, she died very, very quickly. So when that happened, I was older. I was a fully formed adult, and it was enormously tragic and very painful. And so when I think of breast cancer, I think of my mom, but I also think of myself. Even though I'm not biologically related to my mom, I'm adopted, I do have irregular mammograms pretty much every time I go in. So I have to get additional screenings. I need to get sonograms. And I just sit on pins and needles as I wait, hoping that when the phone call eventually comes in, that the doctor or nurse on the other end of the line will say, everything's fine, everything's benign, it's all good. That's my experience with breast cancer as somebody who lost a family member to it, and somebody who takes my own breast health very seriously. Unfortunately, breast cancer is very common, affecting 12% of the eligible population. That's roughly 1 in 8 people, and many of us will know someone who's been touched by the disease. Thankfully, with modern treatments, mortality has significantly dropped over the last 30 years. But learning of a breast cancer diagnosis is still the sort of news that can completely disrupt your life and the lives of those around you. So, to help us understand what happens after a breast cancer diagnosis and how to support our loved ones as they go through treatment, we're talking with Dr. Tufia Haddad. She's the author of Beyond Breast Cancer, a Mayo Clinic guide to healing and wellness. Dr. Haddad, thank you so much for joining us.
Thank you very much for the invitation.
So, receiving the diagnosis of breast cancer can be incredibly traumatic. Dr. Haddad, in your experience, how have patients reacted in terms of how they've taken the news? And also, what were their physical symptoms at the time?
It's a lot to process. Physically, many people are not experiencing symptoms. It is most often detected on screening mammograms. Even when patients do have a breast mass that they note or bring that to medical attention, often there is no pain necessarily. But mentally, absolutely, it is a very challenging diagnosis. I would say the hardest time that I see for my patients is from that time of diagnosis to the very first treatment intervention. Like, in some regards, time can't move fast enough, right? Like, I just want this tumor out. I want surgery today. On the other hand, it's so important to have all of that diagnostic information to be sure we are firm and clear in terms of the diagnosis, those are so critical to formulating that treatment plan. And that treatment plan helps us to understand the urgency by which we need to get treatment started. For some breast cancers that are caught very early, very small tumors, no spread to the local lymph nodes, very slow growing, those are often cancers where we can take some time to help guide women in their decisions, even decisions about surgery, whether to have a partial mastectomy or lumpectomy versus a full mastectomy. But on the other hand, when we sometimes have that more aggressive tumor, it is important that we get treatment started in timely fashion. And again, more often than not, it is our medical therapies that we start with in that particular situation. So I think this is why having those discussions with that multidisciplinary team is so important so that you can help plan and understand what you're up against in terms of the treatments that are projected to occur over what duration. That's what can help people feel like they have some control and know what to expect in a time where otherwise there is just immense uncertainty.
Mm. And if I were your patient, what are the questions that I should be asking? I'm sure that a lot of the patients just want to know, what are my chances?
Yeah, so that definitely is one of the earliest questions we get. There's interest in understanding prognosis, as well as interest in understanding treatment. You know, what am I up against? What types of treatment do I need? How long is this going to, put me out? Your life doesn't pause when breast cancer is diagnosed.
Mm-hmm.
You need to figure out how to manage it despite all your other usual commitments and responsibilities. So one of the most important things to ask is, can I record the conversation so I can have this to go back and fall back on when I have questions that come up? I can't remember everything the first time we met. So I encourage people to ask for permission to record the visit, get access to their medical records. Second thing is you want to know, what is my stage? Our breast cancer staging would include information about the size of the tumor, lymph node involvement, and the underlying biology of the tumor. Some tumors are very slow growing. They tend to be estrogen-driven tumors, but some tumors are more fast growing and they have different molecular characteristics. So there are 4 stages. Stages 1, 2, and 3 are breast cancers that are either confined to the breast or have spread to local lymph nodes and are treated for cure. Whereas stage 4 breast cancer is breast cancer that has spread to other organs. And in that case, most commonly, that is breast cancer we can't cure, but is still highly treatable. Depending on the stage status, that again helps us to know which treatment modality we are going to start with, whether that's surgery, or sometimes we use medications before surgery. And so the third question would be, what are my treatment options? What is the sequence? In what order do I undergo these different treatment modalities? And then I think also very importantly, the last thing I would recommend is, would I benefit from a second opinion? And certainly if patients are not feeling comfortable with what has been recommended, or if they're told they have a rare some type of breast cancer, I very much encourage people to be requesting a second opinion.
I am so glad you mentioned getting a second opinion, because I think that as disempowering as it can feel to get that diagnosis, it's really important that patients feel in control of the decisions that they're making and also well-informed of all the options available. Speaking of which, can you describe what those options are?
At a very high level, we think about 3 main disciplines: surgery, medications, and radiation treatment for breast cancer. As it relates to surgery, often there will be options of a partial mastectomy or lumpectomy versus a mastectomy. And for those women who are choosing mastectomy, they may have the option for breast reconstructive surgery as well.
And just to clarify some terms, a lumpectomy, also called a partial mastectomy, is a surgery that removes the cancer while trying to preserve as much of the healthy breast tissue as possible. And with a mastectomy, the whole breast is removed. Sometimes the nipple can be saved, but sometimes it's just not possible. Either way, it can feel like a big physical change, which is why some patients consider reconstruction.
Right, right. As it relates to the medications or systemic therapy, systemic meaning medications that get in the bloodstream and circulate all throughout the body, whether they're pills that you swallow, get absorbed, and then into the bloodstream, or those that are administered intravenously or by injection and can help kill cancer cells wherever they may have gone. So chemotherapy used to be all we had for managing breast cancer, and especially more aggressive subtypes of breast cancer. But we have so many different types of systemic therapies now. And then for radiation therapy, we historically have had, for many people, 5 to 6 weeks course of radiation. But in some cases now, we are doing partial breast irradiation, sometimes just in 5 days, 1 week. So there are many options even within each of these treatment modalities.
Again, for our listeners, the basic idea with any radiation therapy is that we're showering those fast-growing cancer cells with high-energy particles like X-rays or protons. It's often done after surgery to kill any small cancer cells that might still be in the area, which helps make sure the cancer doesn't come back or spread. Now, let's talk a little more about chemotherapy. What exactly is it, and why, in some cases, does it seem like a miracle and yet maybe also has a bad reputation? And what do alternatives look like? And also, how do they work?
Well, chemotherapy works by shutting down cells that are dividing rapidly, like cancer cells. But because we have some other normal cells in our body that are dividing rapidly, they're also susceptible to chemotherapy and side effects. So when people lose their hair, that's because our hair turns over daily, right? We lose a little hair, we grow a little hair every day, and that's why it is often so susceptible to chemotherapy. But then we also now have HER2-directed therapies. HER2 is just the name of a protein that is present on some breast cancer cells. And when it's present in abundance and is activated, that's what sends the signal to tell those tumor cells to grow and divide very aggressively, commonly. HER2-directed therapies, these are antibodies that go to the HER2 proteins and help shut down that growth pathway. But because they're antibodies, just like we make antibodies to fight infections, these are antibodies to fight cancer cells. So it also helps engage your immune system to come help destroy these tumor cells. So now HER2-directed therapy in combination with chemotherapy was associated with, a 50% reduction in risk of breast cancer recurrence and a 40% improvement in survival for what used to be a very dreaded subtype of breast cancer. We also have those anti-estrogen therapies. They kill cancer cells in a very different way than chemotherapy kills cancer cells. They come with a very different set of side effects, but they're relevant to a large group of patients diagnosed with breast cancer. Anywhere from 2/3 to 3/4 of all breast cancers will be estrogen or progesterone driven. Now we also have immunotherapy. So our very first immunotherapy agents have been FDA approved just within the last 3 to 4 years here now. And so for one of our other subtypes of breast cancer that gets the name triple negative breast cancer, we significantly reduce the risk of recurrence, improve long-term survival by including immunotherapy now with chemotherapy. So again, I call it systemic therapy because we have all these different subclasses of medications that we can use to help. Ultimately, our goal is to help eradicate cancer cells all throughout the body, not just those tumor cells in the breast or potentially in the local lymph nodes.
So you've just mentioned some different treatments. How do patients and their doctors decide which treatments to undergo?
So for the subtypes of breast cancer that I was just speaking to, the HER2-positive breast cancer and triple-negative breast cancers, with pretty uncommon exception, we are giving those medications before surgery. And we do it for a number of reasons. One of the reasons is it gives us the opportunity to shrink the tumor and potentially remove tumor from the local lymph nodes when it has already spread by killing it with chemotherapy, immunotherapy, or HER2 therapy before surgery. So that potentially can mean that less healthy tissue needs to be removed at the time of surgery. And it goes without saying, by doing less surgery, that will often lead to fewer complications from those surgeries. One of the other reasons is it also gives us the chance to understand, are these therapies working? When we give these medications after a surgery, we don't know whether or not we're eradicating tumor cells. But when we give it before surgery, we can actually see the before and after. It really helps us to understand prognosis. When patients go to surgery after receiving those medications first, if there's no residual cancer, they have a fantastic long-term prognosis. They have a very low risk of recurrence in the future. Whereas patients who still have some residual cancer at the time of surgery, we know they're at higher risk for recurrence. And now, many thanks to research and clinical trials, we have better treatments we can give after surgery to help improve prognosis and help reduce the risk of recurrence. But we only give those extra therapies to those who are going to benefit from it. So it helps us to be good stewards of the medications and trying to right size and be more personalized in terms of the medications we're selecting.
You mentioned clinical trials. If a patient is being treated, how do they get involved? Does their oncologist enroll them in clinical trials? Is there another process?
Yeah, all of these advances, all of these new classes of medications, the de-escalation, I would say, of surgery and as well radiation therapy, all of those advances come from clinical trials. And often clinical trials are proposed to patients by their oncologists or their surgeons. But I always encourage people to be asking their clinicians, their care teams about clinical trial opportunities. I don't want people to think that clinical trials are just as a means of last resort when you have no other options available. In many cases, people will be receiving at a minimum what would be considered best practice standard care. But half of the patients in a clinical trial would receive something potentially better, or at least in laboratory-based research has shown a lot of promise that we're now bringing it forward into human clinical trials as well.
When children have anxiety disorders or OCD, they may feel anxious or upset, even when there's nothing happening around them that would frighten or bother most other kids. And as parents, we're all just looking to help our kids through whatever they're experiencing. If you're a parent to a kiddo with anxiety or OCD, pick up a copy of Anxiety Coach, published by Mayo Clinic Press. In it, clinical psychologist Dr. Stephen Whiteside shares practical skills, tools, and guidelines to help parents carry out exposure therapy with their child at home. Start your family's journey toward anxiety-free living today. Get your copy of Anxiety Coach at mcpress.mayoclinic.org and use code KIDS for 10% off your order today.
Before we move on from the physical impact and immediate intervention phase, let's quickly recap the diagnosis information and short-term treatment options we've talked about so far. So the first thing you want to understand is your stage. And that simply tells you how big the tumor is, how fast it's growing within your body, and whether it's spreading to other areas such as your lymph nodes or other organs. Stage 4 is the most serious, but it's still treatable. As far as treatment goes, doctors have 3 general kinds of tools available: surgery, medication, and radiation. Depending on your stage, your doctor may recommend one over the other or a combination of treatments. There's also clinical trials, which can get you access to new medications and treatment options. Make sure to ask your healthcare team about that and your potential eligibility. Now, a big part of treatment is obviously, we understand this better nowadays than ever, is also psychological care, because this is life-changing, not just, emotionally, but also logistically. It can disrupt a person's home life, their work life, their whole identity. So what advice do you have as far as getting psychological support throughout this?
Yeah. Increasingly, we have psychologists who are dedicated to cancer psychology, and they are just tremendous resources. On the other hand, not all oncology practices have good access to resources that can help support patients. The important thing is just to, again, have a conversation. Many people sometimes wait too long before they ask for help. If it isn't something being proactively screened or monitored, to be able to ask for help from your oncologist, your surgeon. Some people feel more comfortable talking to a nurse or a nurse practitioner on the team. Many cancer clinics have patient navigators, and sometimes those navigators can help them find some of the resources that might be available in their community. And then as well, social workers who can help support many different aspects of navigating cancer care as well. Many times there are peer communities and peer groups. Otherwise, even a trusted friend to help be a sounding board and potentially to help find resources that might be available. So it is so important. If we're not addressing the psychological aspect, it just amplifies every other challenge that people face as they're navigating breast cancer.
I think it's incredibly important to have an outlet to be able to talk about these issues, maybe through a faith community, maybe through psychological support. For a lot of people, these absolutely go hand in hand with the biological treatments you mentioned.
Yeah. And certainly some people are very much in denial and even angry with the diagnosis, how disruptive it's been to their life, or if they were someone who was literally following the textbook for how not to get cancer and then they get cancer. It's absolutely devastating. So what I encourage my patients when I see that happening is if they don't proactively address that anger or proactively address that denial, it will come to cause challenges, cause issues, and manifest in other ways downstream. So I do think it's important to be addressing those issues upfront, best one can, as they're going through treatment.
Now, doctor, I grew up with a mother who had breast cancer, and I was really young and not really certain about what to do. I didn't really understand the big picture of what cancer was. For those who want to support their loved one with breast cancer in the best way that they can do, what advice do you have for them?
Yeah, Kristen, this is such a great comment and question. And I share with you, I also had a mother. I was 17 when my mother was diagnosed with breast cancer. And it is the most helpless I've ever felt in my entire life, honestly. All I could do really was just offer to be there and be present as much as I could. So I encourage my patients, family members to be accessible, to be that sounding board, to lean in and help when help is needed. Those are some of the most important things. I would also say being there at appointments is so helpful as well, because particularly when people are going through active treatment and their mind is just trying to process everything, it's really hard for them to keep up with recommendations, or if a medication adjustment is made, having someone else with you at those appointments to be taking notes, to help and just navigate the care coordination is something that can be very valuable. And you don't necessarily have to have a medical background in order to be that person.
What about sexual health? A patient who's undergone treatment might have a lot of changes to their body, and I imagine that can affect that aspect of their life.
Yeah, sexual health is and sexual dysfunction after breast cancer is incredibly common. 40 to 70% of patients will express that they are experiencing sexual dysfunction. And importantly, this happens across all age groups. It happens to both men and women with breast cancer, where there are body image changes because the breast has changed, whether it's from surgery or radiation or reconstruction or people who choose to go flat after mastectomy. Then we also have our anti-estrogen therapies, which especially when we apply them to someone who's premenopausal and now we make them feel like an old lady because we are starving and depleting their bodies from estrogen. So you have the physical changes and then sometimes these additional hormonal changes, and it can be incredibly disruptive to body image, to sexual health. The most important thing is, again, to have the awareness as best one can, the acceptance, and to have good, frank, honest communication is one of the best ways to help address it. And then as well, talk to your oncologist or talk to, if you have a women's health specialist, many general internists or women's health specialists can help patients navigate some of these changes as well. There are sexual health counselors. There are many different things that people can do to help address these issues after breast cancer treatment.
We talk a lot about the physical and mental effects of having an illness like breast cancer, but there's also the financial fallout a lot of people experience after illness. So many times patients are the sole provider or main breadwinner in the family, and they can't provide in the same way when recovering from treatment. Do you have any thoughts on that or resources you can point folks to help them through this period of financial stress?
Yeah, many people will refer to this now as the financial toxicity. It's a significant complication, if you will, of breast cancer and in cancer treatment more broadly. Many cancer centers do have financial counselors now to help people navigate the complexities of working with their insurers, making sure that they are getting the benefits that they deserve through their payers and providers. If people have challenges with their job, we encourage them to be speaking with these counselors, be speaking with social workers, and don't hesitate to let your care team know as well. If you are having challenges with a prescription medication that may be too expensive, sometimes there are resources and means by which we can get medications covered for by the companies that make these drugs. So as much as someone can be transparent in sharing this information, I know, again, many people feel uncomfortable having those conversations, but it's so important to disclose because it just makes every other side effect amplified when you're dealing with the distress of financial toxicity from cancer treatment.
All right, let's talk about life after breast cancer treatment. How do you follow patients after the initial treatments? How do you follow them throughout their lives?
Typically, the first 2 to 3 years after treatment is completed, we'll see people back on an every 3 to 6 month basis. Years 4 and 5, every 6 to 12 months, and then after that, once yearly. And the follow-up with your provider is really just to assess symptoms, assess any lingering side effects, to be doing surveillance for some of the late complications of treatment, and then importantly, the surveillance for breast cancer and potential recurrence. But really beyond that, there is no role for any routine blood work, any body scans. Those things have been shown through clinical trials and research to not add value. So our standard practice is the annual mammogram and physical exam.
What if during one of those follow-up exams there is a recurrence? And how common is that?
Yeah. So for many people with very early breast cancer that has not spread to local lymph nodes, the risk of recurrence is quite low. No more than really the odds of getting breast cancer in the first place, kind of that 1 in 8 or roughly 12% risk. But for some of the more aggressive subtypes of breast cancer, and especially if they were not as sensitive to some of our medications, that risk of recurrence may be substantially higher. But in those scenarios, the Recurrence, if it's detected while it is in the breast tissue or in the local lymph nodes, we will often again treat for cure. But if it comes back in other organs, stage 4 breast cancer, metastatic breast cancer, as it stands today, that is still typically breast cancer we can't cure.
Let's talk about the bigger picture of what to do after surgery, after medication, after interventions, and so on. What should somebody who has gone through all this, hopefully, fingers crossed, successfully, what should they be doing going forward with their lives?
Yeah. I will say probably one of the most challenging transitions is when people have been with us weekly, daily, even during their radiation treatment, actively doing something to overcome and to beat breast cancer. There's this freight train of diagnostics and treatment, and it's just go, go, go. And then we say, come back in 3 months. That transition to survivorship and surveillance can be immensely challenging. This is the first time people are processing what just happened. And this is sometimes when anxiety or depression can unmask itself. This is where we want to have all those resources available to folks. But in terms of kind of the practical, how to help address and help support people through this transition, it is that physical activity. There is very good research to show breast cancer survivors who are physically active, moderate physical activity, 30 minutes, 5 days per week, they have a lower risk of breast cancer recurrence and improved survival from breast cancer. And it has nothing to do with weight loss. And it has nothing to do with your baseline weight or body mass index. As long as you are physically active, you will derive that benefit. A healthy diet, it perhaps also goes without saying, but I always encourage folks shop around the perimeter of the grocery store, not the aisles. So more whole foods, more fruits and vegetables, and less processed foods. Let food be your way to get those important vitamins and nutrients. I encourage people, if they're thinking about taking vitamins or supplements, talk to your oncologist about it. Make sure there aren't any interactions with some of the other medications you are taking, because we do have some research to suggest that some vitamins and supplements could be more harmful than beneficial. So definitely talk to your team about that. Meditation and mindfulness. There's so many different ways to go about incorporating a little bit of mindfulness or meditation into one's daily routine. They actually did a study that compared mindfulness against prescription sleep aids. And guess what? The mindfulness training was just as effective as taking a prescription sleep aid. Some other research shows that it helps to boost the immune system as well. So there are so many potential health benefits. That is something else that I think so many of us could benefit from. I always say I should practice my own medicine. I preach here, but there are some really simple ways that people can help just bring even 5 minutes of mindfulness into their daily routine.
Well, this has been such an informative and compassionate conversation. We are so grateful that you joined us today. Thank you, Dr. Tufia Haddad.
Well, Kristen, thank you very much for the opportunity to join in this conversation and to help support people who have been diagnosed with breast cancer.
So one of my biggest takeaways is how important communication is throughout the whole process with your medical team, friends, family, and partners. If something's feeling confusing or you're overwhelmed and need help, don't hesitate to speak up. The diagnosis and different forms of treatment can impact people in many different ways. It can change your daily routine, your body image, your mental health, your energy levels, and even your financial stress. Many cancer centers have clinicians and support staff who are specially trained to help you through every part of this journey. And even people who aren't specially trained can help a lot. Your friends and family can help by going to appointments with you, taking notes, being present, holding hands. Small everyday efforts can make a big difference. And remember, if you're over 40 years of age and have breasts, you should be getting a mammogram every year or every other year. And if somebody in your family has either had breast cancer or has a relationship to breast cancer, talk to your doctor. They'll help you assess your personal risk and make screening recommendations that are pertinent to you.
With so many options, why choose Arizona State University?
For me, the only online option was ASU because of the quality. Their faculty was really involved with their students and care about your personal journey. The dedication to my personal development from my professors, that's been extremely valuable to me.
Earn your degree from the nation's most innovative university. Online. That's a degree better. Explore more than 300 undergraduate, graduate, and certificate programs at asuonline.asu.edu.
Okay, that's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more information about navigating life after a breast cancer diagnosis, check out Dr. Haddad's book, Beyond Breast Cancer, a Mayo Clinic Guide to Healing and Wellness. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.
Have you ever wondered how artificial intelligence is helping solve medical problems, or how medical research is making it easier to predict your genetic risks for disease? Hi, I'm Kathy Wurzer. Tomorrow's Cure, a podcast from Mayo Clinic and PRX, is back for Season 2. Join me as I interview experts who are shaping the future of healthcare with groundbreaking advancements. What they describe may sound futuristic, but listen and you'll find out. Tomorrow's Cure is already here. Find it now wherever you get your podcasts.
This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.